Thank you, Mr. President. You know, for months, we've gathered in this chamber to talk about why we need a public option in health reform. And it seems like almost every week, the insurance companies give us yet another example why a public option is critical to ensuring that all Americans have access to quality, affordable health insurance. Our most recent examples are courtesy of two of America's largest insurance companies, Humana and Cigna. You see, Wall Street just completed its third quarter earnings season, and Humana and Cigna released their reports a couple of weeks ago. Let's just say that both companies did really well last quarter. Now look here, Humana profits in the third quarter, 65%. Cigna profits in the third quarter, 92%. And Senator Brown, I know you've focused in on this insurance company issue here and seeing what's happening to the American people. I mean, this is happening at a time when 47 million Americans are without access to affordable health care. And so I would ask you to speak a little bit about the whole insurance company issue and what's happening here. But before I go there, let me just say one word. The Republican leader was here on the floor, and he was talking about the numbers that were given by the CBO. Now, the numbers that are given by the CBO, these are number crunchers. They're bipartisan folks. These are people that work very hard. They work late at night. They've been working to get out their numbers on the bill that we're going to have on the floor here in just a little bit. And I can't believe that we're now hearing that, oh, they don't like the CBO numbers. I mean, we all, both sides, live by CBO numbers, and that's the important thing for people to understand. Senator Brown, I yield to you to talk a little bit about
Senator Udall, and we're also joined by Senator Reid of Rhode Island and Senator Merkley, who have been real leaders. They helped write the bill on the Health, Education, Labor, Pension Committee. It's not just, it's these profits, to be sure. We know that the Aetna CEO last year made $24 million. We know their profits have gone up 400% over the last 7 years. But it's not so much that their CEOs paid so much. The top 10 insurance companies in the country, the average CEO pay is $11 million in each one, $110 million in pay last year for the 10 companies. It's not just their profits and their CEO and top executive salaries. It's their business model that gets them there. And when you think about what's happened to the insurance companies, if you're a big insurance company, you hire a bunch of bureaucrats to keep people from buying insurance, to invoke pre-existing condition so somebody can't get insurance, or to put limits on coverage so people can't get insurance. And then they hire a bunch of bureaucrats on the other end to deny claims. 30% of claims that are filed, when people get sick, they turn their claims into their insurance company, from hospitals, doctors, treatments, whatever. They turn to the insurance company. 30% of them are denied initially. They are appealed sometimes, and then they get their reimbursement, a customer, an insurance, someone who files a claim. But the fact that they have to fight the insurance companies is while they're sick anyway, or while they're advocating for their parent or their sister or their husband or their wife. So these huge profits and these huge executive salaries are based in denying care on pre-existing condition, based on squeezing profits from customers who see their insurance company. Think of all the small businesses we know in Rhode Island and Delaware and Oregon and New Mexico and Arkansas, the presiding officer state. The small businesses that come to us and say, we can't afford our insurance anymore. We've had these huge price spikes because one person in my company out of 30 employees gets sick. So I don't care all that much about profits and care all that much about CEO salaries. I think it's pretty immoral. But what I do care is they've based it on hurting people who have insurance, or keeping people from having insurance that had it.
Senator Brown, you know, and you ask a question, how can a business do this? I mean, how can a business do this? And there's a real reason why they can do it. It's because there's no competition. Another company can't do that. A company's out in place. It can't treat the people that are its customers the way the insurance companies do. And when you look at the list, you can see why they get away with it. Because there is no competition. The top 39 states out of our 50 states, over 53% of the market share is with two companies. I mean, look at this. So there is the idea that there's competition. There is no competition right now in healthcare. And that's the big reason why we need the public option. The reason for the public option is the public option allows us to have competition in these states where there is no competition at the present time. And you can have gigantic profits. You can have CEOs making millions and millions of dollars. You can have all these things. You can treat your clients poorly, your customers poorly. You can do all those things because you don't have to worry about somebody coming into the business and offering them a good or better deal. And that's what the public option does.
Would gentleman
Senator
yield?
Reid, I would
Thank you.
recognize you and obviously get you involved in this roundtable and discussion we have here on the floor.
Well, thank you, Senator Udall. Senator Kaufman has made an excellent point. What we've seen over the last several years, actually more than a decade, is increasing costs shifted to small business. Just this year, it's anticipated that 15% increases in small business, much higher than inflation in terms of their premiums. And that is because there is no real competition. Rhode Island is in that map. There are two companies that control 80% of the market. And there's forces, which you've illuminated, that drive up this constant increase in cost. One is the profits. That's what private companies are organized to achieve. And if we were directors of those companies, we'd be trying to do that. And those profits drive two things. One, shareholder return, profitability of the stock, and also compensation for executives. Those two phenomenon will not be in place in a public option. It'll be a not-for-profit cooperative arrangement. So the response will not be to shareholders or to self-aggrandizement of the executives. It'll be to delivering service. And that is going to be a check. What I find ironic in this whole discussion is the bold proponents of free markets. The bold that the free market can solve it are afraid of competition. They're afraid of a public option because, that we can't compete with the government. Their definition of competition is any competition. I mean, they're probably worried about 80% shared between two companies. This is a managed environment, and year in and year out, the insurance companies do great, and small business does worse and worse and worse, and I thank the gentleman for...
Just one final point I'd like to make, and that is you can tell there's no competition when every year your premiums go up. What kind of the only other business I know that's like that, and I don't mean to hurt anybody's feelings, is the cable companies and my TV bill. The only two bills that I know every year, no matter whether inflation's down, cost of living's down, all these things down, the two bills that I know when I get them in January, I'm going to get a notice right in December, don't we all? Basically says my health care premiums are going up and my cable costs are going up. And the reason is because both of these are essentially operating as monopolies.
And Senator Kaufman, the issue on this competition, and I don't think the American people realize this, is that we have exempted the insurance companies from the antitrust laws. And those are laws that you can move in when there is a lack of competition in the market, when there are too few players in the market, to try to inject additional competition in the market. And so really, what the public option, the first thing that we're trying to accomplish with a public option is to inject that competition into the market, to have insurance companies be competing, and this public option is going to help drive that cost down, drive it down in a dramatic way. Now, I know Senator Merkley, who's worked on this health care legislation in his committees, he's joined us here today, and I hope he can talk a little bit about this issue also.
Well, I just wanted to interject. There was a time when our colleagues across the aisle were in favor of competition. Now, correct me if I'm wrong, but in the past, we used to have a highly regulated, non-competitive airline industry. And was it not our good friends across the aisle who said, we need to create competition so consumers have real choice, and this will drive the cost of airline tickets down? Am I mixed up on this, or is that fairly accurate rendition?
I think that's an absolutely accurate.
Well, we're in a very similar situation here, where we have a non-competitive industry costs going through the roof, and there's a basic factor at work, which is if we introduce competition in healthcare, service will improve, costs will come down. Now, I want to mention that choice is much more important in this area than just about any other. Because if you're not satisfied with the cost of your insurance or the service you're receiving, then you should have multiple other places to go. And that is the underlying point of creating a healthcare marketplace or exchange, as it is called, so citizens can go and say, hey, here are all the plans competing against each other. What are they going to offer? And then a year later, if you're not happy, you get to switch, which says to every single insurance company that if we don't do well, we're going to lose our customers. That's a marketplace. That's competition. That's what we need in America, and it will be helped by having a public option.
Absolutely. No doubt about it, Senator Merkley.
Well, I can tell you a couple stories from Oregon. There was an article that came out in the Bend Bulletin in October about two families. One individual, Dale Evans, he went to his doctor because he was experiencing heart pain in his chest or pain in his chest, and his doctor recommended that he have an MRI to find out what was going on. The request was made 3 times. The insurance company turned it down 3 times. Well, because he didn't have this test, there was no diagnosis made of a cancerous tumor that he had. And this cancerous tumor proceeded to damage his nerves and his spinal cord, left him unable to walk, and then became too large to be operated on. And Mr. Evans died the following year, in 2008. Choice made by the insurance company, a for-profit insurance company, the result was the test was not made, the individual dies. Richard Paulus of Bend, Oregon, has a similar case being filed right now. He is, fortunately, still alive, but he was denied reported requests for back surgery. His doctor arranged for a second opinion, the request was made, turned down again. Now, one factor is you want to have an insurance company that's making decisions related to healing, not related to profits. But the second is, one of the best ways to drive that is if Mr. Evans and Mr. Paulus weren't satisfied, if they had a choice, they're much more likely to create accountability with the company that they're with right now.
Senator Merkley, one of the things I want to ask you about those circumstances, because you know more of the details here, but really when you have insurance companies, these for-profit insurance companies that we've been talking about that are making incredible profits, when you have insurance companies denying these claims, which is what you just alluded to, what people need to realize is what they've done is they've created an entire administrative bureaucracy within the insurance industry, and it's flowed over into our medical providers, where doctors now tell me what they have to do is have people that are calling to the insurance company to push to these and reverse these denials. And so they've created a whole system which tamps down the ability of people to get care. And so really what we're talking about in the public option, isn't it, is you stand up a nonprofit. They're not in the business of making a profit. They are going to be in the business of providing health care, of doing the very best they can provide health care. And why it will make the market competitive is that they won't have all this administrative runaround. They won't have this going on. Is that your understanding? And so they will look at the situation that you have right there that you've described, and they're going to say, oh, well, it's clear this gentleman needs an MRI because we need to find out what's going on. And so they'll do the MRI, and then they'll move quickly to the care. And then to me, that's the difference between what you described, where insurance companies are trying to find a way to not pay out to meet their bottom line and to raise their profits, whereas a public option would be doing just the opposite, focusing on the health care, focusing on the future needs, focusing on providing the kinds of things that people need in the healthcare arena.
Well, your point's very well taken, because the overhead in the private healthcare industry is now 25 to 30%. That's a whole lot of folks sitting around desks, operating with paper, rather than nurses and nurse practitioners and doctors practicing the craft of medicine, the craft of healing. Whereas if we look at Medicare, instead of 25 to 30% overhead, it's somewhere around 3%, much less, and therefore a lot more dollars going into actually assisting folks in getting well. Again, competition is going to drive down that overhead.
And the thing that, Senator Merkley, that people should know, the American people should know about the health care plan that Senator Reid was down here talking about earlier, that we've unveiled here in the Senate, is it has a public option in it. So the public option will be there to provide competition. It will be there to provide the very best care, and it'll be there to make sure that we hold these insurance companies honest. I mean, that's really what we're trying to do here. Is make sure there's competition in the market, make sure the insurance company's honest.
Yes, and the reason we've lost competition is twofold. One is that in many markets, a single company dominates the market. The second is, even if you have multiple companies, they are exempt from the antitrust laws, and therefore they can communicate with each other in a way that reduces or even eliminates the real competition. So that's why this is so important. There is one feature of this public option that I think it's important to recognize. It represents a huge compromise. And that compromise is that many of our senators said, we're not sure our folks back home are quite sold on this idea. And we don't want to see it, quote, forced on them. And quite frankly, I think it'd be good to have competition everywhere in the country. Have everyone have more choices. But in deference to that federalist tradition in America, in deference to the laboratory of state experimentation, a provision has been included in Senator Reid's merged bill that says a state, if it does not want to participate, it can opt out. So there is no senator in this chamber who have any concern about saying states my folks back home don't want this, and they're going to be forced to have it, because no state will be put in that position. Any state can choose to say, we do not wish to participate. And I think that means that we will have a situation where many states, most states I believe, perhaps virtually all states will say we do want to participate, but those states that are not so convinced, they will have a choice to watch this unfold and decide if they wish to join this movement for competition and choice later on.
And Senator Merkley, I really think that is a great example of how we all work here together to find a compromise that works for everyone. And I realize there are Democratic senators and Republican senators, and the same for governors, that may want to do things differently in their state. And so what we've done here is give them the option of opting out in this public option that we're providing. I personally, looking at the facts and looking at the situation, I don't know why a state would want to opt out. But there's going to be the check and balance there of the legislature having to pass a law, governor having to sign it, and say, we don't want to have anything to do with the public option. But we realize that with a public option, that you bring competition to the market. You expose these high administrative costs that you just talked about. You know, one of the things people don't realize on administrative costs is the federal government runs the Medicare program. Here you have a program that when I go to town hall meetings, I say, raise your hand if you're on Medicare. And they'll put their hand up, and I'll say, keep your hand up if you like Medicare. And so they'll raise their hand and they'll keep it up. 95% of the people like Medicare. Well, Medicare has a 3% administrative cost. And as you just said earlier, the insurance companies that we're dealing with, they have anywhere from 25 to 30% administrative costs. And so if you put a public option out there, you're going to find that competition, and you're going to make there be competition. Senator Merkley.
Well, let me give you an example of how that competition can work in a health insurance marketplace. In Oregon, we have a public option in workers' compensation, which is health insurance for injuries that occur on the job. Well, we've had this public option for 80 years. It didn't really work that well. Wasn't that well designed, wasn't that well managed. About 20 years ago, a group got together of businesses, and the businesses said, we need a better insurance policy. We need a better competitive market for on-the-job health insurance. And so in a deal that was called Mahonia Hall deal, Mahonia Hall rewrote and improved the management of our public option, and the result is rates today in workers' compensation in Oregon are half of what they were 20 years ago, because competition was introduced, efficiencies occurred, service improved. And I can tell you, there isn't a business in Oregon to be found campaigning to eliminate the State Accident Insurance Fund, which is a public option in work-based health care. Now, our colleague, Sheldon Whitehouse, was involved in establishing a very similar program in Rhode Island. And their workers' comp, he told me, and I think he's told this chamber, that competition introduced by Rhode Island adopting a work-based health care public option resulted in their rates dropping by half. Well, wouldn't it be great if competition could reduce health care costs in America rather than having 10 to 15% increases every single year?
Yeah, Senator Merkley, you hit it on the head, and I've been here on the floor with Senator Whitehouse. I know Senator Reid was just here participating in the colloquy, and the point that both of them, I think, make is that when you inject a public option into the insurance market, whether it's health insurance, whether it's workman's compensation, you inject competition. And by injecting that competition, you make the marketplace work a lot better. And that's really what we're striving for here today.